Alameda Medic 2, code 2, ETA 5 minutes. On board, I have a 32-year-old female complaining of abdominal pain and nausea vomiting. Patient was transported yesterday for the same reasons. She's learning from 4 G6 15, following blood pressure 135/87, heart rate of 80, estimated 100% room air, respirations 18, blood sugar was 102, ETA 5 minutes.
Afternoon, Alameda Hospital, medic 327, coming in code 2. Where we have a 53 that is 5, 3-year-old female, complaining of right flank pain. Currently all vitals are stable, seeing about 10 minutes. How do you copy?
Alameda, this is medic 2, code 2, ETA 3 minutes. On board, I have a 56, 5-6-year-old female complaining of bunion pain for approximately 10 years. She's ordered times 4, GCS of 15, vitals following. Blood pressure 139/99, heart rate of 87, SpO2 100% room air, and respirations 18. We have an ETA of 3 minutes. How do you copy?
Good evening, medic. 3 inbound, code 2 is a 66-year-old female coming from skilled nursing for low O2 sats. She's currently at 9.4 liters. She also missed her dialysis today. Got a blood pressure of 92/54, working on some access, pulse of 90. If there's no further questions, I'll see you in 5 minutes.
Good evening, Alameda. This is Medic 1. Approximately 4 minutes out, coming in code 3 ALS. That's code 3 ALS with a respiratory patient, trach patient, currently being bagged, coming from a skilled nursing facility down the road. She complained per staff is that they need a trach replacement. Patient is maintaining for normally, no signs of respiratory distress. He is, as I said, being bagged en route at 15 liters per minute. Blood pressure is 146/83, and we've got approximately 55 seconds ready on the monitor. Any other questions? See you in 5 minutes.
Hi, Alameda. This is BLS 122. We are coming in code 2 for 65-year-old female with a chief complaint of back pain. She's ANO4 GPS 15. Vitals are stable. We're approximately 10 minutes out. How do you copy? Pressure of 170/95, pulse 75, respiration 16, O2 98, room air, and...
Good afternoon, Alpha Base 30, code 2, 71-year-old female complaining of extremity pain starting at around noon today. We have a pressure of 136/70, pulse rate 62, respiratory rate of 16, and a saturation of 94% on command. And we'll see in about 5 minutes. How do you copy?
Good evening, Alpha Base, Berkeley Medic 1. We're code 3, about 5 out. On board, we have a approximately 75-year-old male, GCS of 12. At a thinkable episode in the parking lot of the doctor's office is in for blood work. We found him to be severely hypotensive, last pressure 71/44. We got access, we're given fluids. Sinus on the monitor, totally negative for 70. We'll see you in about 5.
Good evening, Alpha Base. This is Medic 3 coming in code 2 with an 87-year-old female complaining of 15. Vital signs are currently stable. We'll be there in the next 5 minutes. How do you copy?
Good evening, Alpha Base, Berkeley Medic 5, Ranch Facility Code 3. On board, we have an 87-year-old female. Was complaining of abdominal pain earlier this morning about 1 a.m. Upon family's arrival, she was unresponsive in bed. Weak carotids, unable to obtain a blood pressure. She does have a full bloody catheter. Full code, unable to get a blood pressure. Heart rate's about 100, sinus attack on the 12-lead. Respiratory rate 4. We have an OPA and MTA placed and currently bagging her. SpO2 is 92% on BVM. Working on IV access. Unless you guys have anything further, we'll see in about 5 minutes. Any copies? So code 3 respiratory, 42-year-old female. Shortness of breath. CPAP, epi given. Vital signs. Heart rate 116. Blood pressure 145/100. Stat 97. Still labored breathing and very short of breath at 32 times a minute.
Good afternoon, children. This is Falconic 241 on our way to code 2 with a trauma activation. Our ETA is about 10 minutes. The patient is a 10-year-old female, got a ground level fall at school and struck her head on the pavement. She had positive LOC after the fall and again when she was moved to the school office. She's now GCS 15 for vitals, pressure of 100 over 50, heart rate of 70, standing at 98 on room air, blood sugar of 93. Only sign of trauma is lack to the left side of the head. ETA is again about 10 minutes.
Good evening, Eden. This is Medic 339 en route code 2 with an 81-year-old female patient. She has a history of a UTI. Temp is 99. Pulse is 70. Blood pressure is 130 over 80. SpO2 is 94 on room air. Blood sugar's 400. And respirations are 25. And did sepsis over.
Hey Eden, this is Medic 358. We're coming in code 2 with the trauma activation. We've got a 78-year-old female that's complaining of neck pain after a fall. Was last seen normal around 1500, was found down at approximately 1800. Vitals are as follows. We've got 95 pulse, 99% room air, blood pressure of 176 over 80, blood sugar of 168. 12 leads sinus with right bundle branch with history of. Patient is ANO 3, Hindi speaking exclusively, and we're about 10 minutes out. How do you copy?
Eden, Top Ambulance Unit 121. We're coming in code 2 for an unknown age female, code 2. She's non-compliant with medical questions. She is alert, GCS 14. Patient is on a 5150 hold by Alco Sheriffs. Currently in 4-point restraints. Condition has improved. Vitals are stable right now. She's coming in for altered mental status and medical clearance. We've got a blood pressure of 140 over 98, heart rate of 108, respiratory rate of 16, sat at 98% on room air. Finger stick was 101. We're about 9 minutes out. I'll copy last.
Good evening, Highland. This is Medic 241 incoming code 2 with a trauma activation. Our ETA is roughly 10 minutes, depending on traffic. The patient is a 78-year-old female who had an unwitnessed ground-level fall on the street. Positive head strike on the sidewalk and positive LOC 2 times, once right after the fall and once when some bystanders approached her, about 3 to 5 minutes apart for the loss of consciousness. She is now GCS of 15. Only sign of trauma is a lack to the left side of her forehead, as well as an abrasion on her left knee. For vitals, we have pressure 140 over 66, heart rate of 84, satting at 95 on room air, finger stick of 93. Our ETA is again about 10 minutes. How do you copy?
Good evening, Highland, BLS 171 coming to you with code 3 medical traffic. Code 3 medical. On board, we have a 31-year-old female. She's complaining of severe left lower abdominal pain with a history of ovarian torsion. Vitals are as follows. Blood pressure 112 over 80, pulse 113, 24 respirations, 100% on room air, GCS of 15. Patient reports and feels exactly like the last time she had torsion requiring emergency surgery. Our ETA is about 4 minutes. How do you copy?
Good afternoon, Kaiser. This is Medic 339 en route code 3 stroke. A 75-year-old female patient that's 75, last seen normal 1 week ago. She's a GCS of 3. Pulse is 70. Blood pressure is 153 over 70. SpO2 is 98 on 4 liters. End tidal is 38. Glucose is 238, and we will get to you in about 15 minutes. How copy?
Good afternoon, Kaiser. This is Medic 406. We're inbound code 3 SNE alert. ETA 3 minutes. On board, we have an 81-year-old female who had a syncope at home. She's currently ANO 4, GCS 15. 12 lead is showing STEMI. We've transmitted it already. Blood pressure is 170 over 100. Heart rate of 65. Resting 16 times a minute. And 98% on room air. 324 Vascular on board. No nitro. We will see you in about 2 to 3 minutes. I'll copy.
Good afternoon, Kaiser. This is Medic 350. We're coming in code 2. On board, we have a 42-year-old male coming in for a chief complaint of right-sided numbness and tingling, along with a wound to his right hand that is also swelling. It started 2 days ago and has progressively gotten worse since then. He is GCS 15. All vitals are stable. We have the ETA of 8 minutes. How do you copy?
Good evening, County Fremont. It's minute 405. We're inbound code 2. ETA is about a minute. We're just coming from the other side of the parking lot at the Tazita. On board, we have a 45-year-old male currently complaining of flu-like symptoms since last night. Currently, all vitals are within normal limits. If you have any questions, we'll see you in about a minute.